How did you become an occupational therapist?
Good question. Again, I had finished a bachelor's degree in counseling psychology and had never heard the word occupational therapist. So I actually was in a pretty severe car accident, and I got physical therapy and chiropractic care and some occupational therapy. So so that's where I was exposed to it. And the occupational therapy was just a consult, so I really didn't understand what occupational therapists do um, at that point, because I was much more focused on my physical injuries. But I ended up, it was my senior year of college, my last semester. So I ended up getting some incompletes and finishing a little bit later. So that's where there were struggles with just getting everything done and organized with all my medical appointments. So I did my clinicals for my counseling psychology and realized it wasn't the right fit for me. It's a great field, but I couldn't just sit in an office all day. And so I really saw the importance of being active and helping clients get active and outside of their talking zone to an active zone. I grew up very rural, and so we did most of our stuff ourselves. And I've always understood the good feeling after you've cut a cord of firewood and stacked it. You feel good about what you've done. You can see that accomplishment. So so then I started looking. I looked into chiropractic care and figured, nah, not quite right. I was looking into physical therapy, and as I was checking out programs, I came across occupational therapy, and I'm like, what is that? So then when I read, it's about helping people. It's about being a problem solver. We are problem solvers for people's life so they can be independent. I thought that was a perfect match for me, my values, my personality. So the first time I read what an occupational therapist was, I knew that's what was for me. So then I went and I got my master's in occupational therapy, and I loved every day of practice.